Hey guys, Dr. Kyle Loveless here with Queen City Health Center. My wife, Dr. Holly, and I have two clinics in the Charlotte area, one in Matthews, one in South Park. And I want to come to you today and talk to you about back pain. Back pain is the most common reason someone goes to a doctor right now in America. It's the number one doctor's visit reason. And so it's actually an epidemic of back pain right now. And we've seen that with the opioid issues. That's the number one reason people get prescribed opioids. They go to an orthopedic, they have a back surgery, most of the time unnecessary. They'll have a back surgery and then they get put on things like opioids, and then that's where our problems have stemmed from. And I'm not going to go down that route right now, but just to say that is a big issue. And so if you're someone dealing with back pain, this video is for you. I'm going to give you the 5 main reasons that you're going to have back pain. The top 5 things that I've seen coming into our clinic over the past 10 years on why and what was actually causing their back problems. Okay, so if you're someone with back pain, it's most likely one of these reasons is most likely why you have back problems. Okay, I also want to encourage you, if you're someone that doesn't have constant back pain, but it's just a random, every so often sore achiness, that's usually the beginning signs of a bigger problem down the road. So you want to listen to everything I have to tell you today as well. Okay, so let's dive into this. So when it comes to back pain, there's 5 main things that I've seen people dealing with coming into our clinics. Most of the time when someone has a back problem, they let it go for a while. They see if it'll heal on its own. They think it's just a muscle issue. And then eventually it either goes away or it doesn't, right? So let's say the back pain doesn't go away. The next step is most people will go take some ibuprofen or they'll take an Aleve, some sort of non-steroidal anti-inflammatory drug, which in and of itself seems like not that big of a deal. We're reducing inflammation, and many times that'll help with the back pain in the moment. Okay, the problem is we never address the reason why you have the inflammation in the first place, number 1. And number 2, the problem is that NSAIDs, last year the FDA, or 2 years ago, the FDA came out and said that they cause heart attacks. You have a 20% increase of a heart attack within the month that you take it. So taking an NSAID or a non-steroidal anti-inflammatory drug like ibuprofen, Aleve, and all those other things is a bigger deal than you think. Okay, so it actually causes damage to your gut and all these other issues. So we'll take an ibuprofen, over-the-counter med, maybe a Tylenol, something like that. And then if the problem still isn't going away, then we go to our doctor. And we go to the doctor, they typically don't know much of what to do because it's just not in their realm of practice. They don't have a lot of answers for it. Their answer is going to be, okay, well, let's do physical therapy. And that typically doesn't work with chronic low back issues. Or they'll simply say, okay, let's try a steroid injection. And unless you have major nerve issues traveling down your legs, or if it's in your upper back, down your arms, they're not going to do major testing like MRIs and things like that typically, unless it's been there for long enough. So they'll do maybe like a steroid injection, which just, I've talked to so many people about this. Actually talked to someone that works and does a lot with Ortho Carolina, and they said steroid injections, they agree with me that steroid injections need to stop happening. They're happening way too often, and they shouldn't be happening unless it's a last chance thing, last thing you can try to get rid of the pain, because they break down ligaments and tendons. So we get that steroid injection. Now we're breaking down our ligaments. Now we're breaking down our tendons, which will definitely cause a back problem down the future, even though you're out of pain for a little bit. Okay. Or the problem gets bad enough, then they recommend surgeries. But even when they take x-rays, an orthopedic or a medical doctor takes x-rays, they're not looking at it the same that I want to talk to you about today. So it's also changing your perspective. So they're going to look at your spine and say, okay, there's no fractures. Maybe there's some degeneration or arthritis, and then they'll just say, okay, take some anti-inflammatories until the problem gets bad enough, and then we'll do things more. So they really don't have answers for it. So the first key is actually figuring out the cause. So here's the main causes that I've seen with back pain. Number 1, first thing that I see people coming in with is something called subluxation. It's where the spine doesn't move, okay? So you can see the spine here, right? All through here, each one of those joints needs to be able to move. I'll show you my trusty poster here. Okay, so each one of these vertebrae, you see the vertebrae through here, each one of these vertebrae needs to be able to move. You can see how it's all moving. And you have joints right through here, okay? And all those joints need to be able to move. The discs need to be able to move to keep fluid in them. So movement is key. As we're going through life, we sit probably 90% of our day, or we have car accidents, injuries, falls, sleeping wrong, sleeping on our stomachs, sleeping all twisted up, whatever that is, sports injuries, working out. And these vertebrae literally will lock up. They'll stop moving properly, okay? When they lose that range of motion, they lose that movement, it creates a stressed response. You can see these are nerves coming out of here. When these joints don't move, the stress and inflammation affects the nervous system and can absolutely cause pain. When you look at the nerve chart, you see all these nerves coming out into the back, and around your body through here, those are the nerves that you feel. Those are the nerves that run muscles, and they're also the nerves that you feel pain from. So when you get inflammation in the area, you're gonna have pain. Excuse me here, I'll put my spine back. So it's going to create pain. And we've felt that before. If you've ever had sciatic nerve issues, that's because you had inflammation on the nerves going down the back of your leg, which is your sciatic nerve, most likely in your lower back. So that inflammation, that subluxation keeps movement from happening, creates a stress response, and in and of itself can cause pain. It's kind of that locking feeling, loss of range of motion. That's probably the most common thing we'll see. That's actually the beginning of the rest of the major problems. Okay, that's the beginning of the disc issue that happened when you picked up a pen, your disc blew out. You had subluxation for years in your lower back, and then eventually you blew your disc out. Many times you don't feel when your spine's subluxated until you create enough inflammation or enough damage, then you feel pain. I have patients come in all the time that felt fine, and they say, okay, my back's hurting me, I need your help. And I'll say, okay, when did it start? And they're like, well, I just started experiencing it 3 weeks ago. Never had back pain before, but 3 weeks ago. Then we take x-rays of their back, and there's disc degeneration. There's all these other other issues in their lower back there. And the problem, but they just felt it recently, okay? Because these nerves over here, only 9% of the nerves in your body actually feel pain. These nerves over here run your heart, they run your lungs, they run your digestive system. You can see out your back comes all the nerves that control the rest of your body. So if those joints don't move and they create inflammation, they create stress, it can cause pain if it's there long enough, but most importantly, it's going to interfere with your nervous system. Your brain has to send signals down your spinal cord, which go out in nerves, and that controls every organ, tissue, cell in your body. This is so huge to understand that if your spine's not functioning properly, your organs won't function properly, because that's the housing system of the nervous system, which runs the rest of the body. I did a video the other day on the same concept of how the nervous system controls everything. So number one is subluxation. Okay, if your spine's subluxated, it's going to eventually cause pain, but it doesn't have to. But if you already have pain, most likely your spine is subluxated. To figure out if it is, you need to go to someone that actually evaluates that. The only people that do that is chiropractors. That's what we do. We evaluate the spine for areas that aren't moving properly or out of alignment, called subluxations, and we remove those with adjustments. That's the simplest thing you can absolutely do. So everyone should really have their spine evaluated before they have pain, but let's say you're having pain, that's it. First step, go to the chiropractor. Get your spine checked. Now, the main reason, there's 2 reasons people tell me they don't want to go to the chiropractor. These are the most common ones. They're not like they're scared or they're nervous. That happens, and you just got to find the right person and connect with them, and then you'll be fine, and they'll walk you through, because chiropractic is ultimately very safe. Been doing it for 10 years, we've never had a problem. However, most people will say they don't have the time, because they know you need to go frequently to get results, just like with anything else that works. And they say, or more importantly, they say they don't have the money. It's too expensive. If you know how expensive it is to actually take care of a back problem when it can become severe, then you would change your mind on how expensive it is, okay? So it's actually very affordable. All the most recent studies right now, and actually many states are saying people need to go to a chiropractor before they go to an orthopedic or before they do anything other than stuff for their back problems like opioids, because of how cost effective it is. It's shown to be the most cost effective thing that's actually effective for your back problem. So chiropractic, number one for subluxation. The second thing that can happen is you can get inflammation in what's called the apophyseal joints. Okay, so let me show you this. So these joints here, okay, so you got your joints, and I showed you these earlier, but these are the joints right here, right? So these are the joints that connect all the spine. They go all the way through in between each individual vertebrae. You have your discs, which you hear about a lot, but then you have your apophyseal joints, okay? Now right through here, these apophyseal joints, they can actually get jammed up. So if you're someone that has a pelvic tilt, this is extremely common with athletes, people that run a lot, soccer players, just really anyone that runs a lot and athletes, these joints right here actually jam up. So you can see it, when I extend back, it jams up those joints. If you sleep on your stomach, this is very common for women. If you wear high heels a lot, this is huge. It creates this thing where you kind of kick your belly out, and you get weak abdominal muscles and really tight hip flexors, and it pulls the pelvis down like this, and you can see it jams the spine up. Okay, if you're someone with forward head posture, many times the neck not moving properly, being stuck here, your eyes want to see straight. So if the upper part of your neck doesn't work, you're going to do this and extend your lower back. That will jam those apophyseal joints. When those get jammed up, they become inflamed, and they can become very painful. And it can be simply just removing the locking of that joint and then working on retraining the hip flexors, so stretching the hip flexors out, strengthening your hip extensors. So if you're someone with pelvic tilt forward, you gotta start doing hip flexor stretches on a regular basis, and you need to start doing hip extensor strengthening. So you can Google those things, you'll find exercises for that, but will strengthen your hip extensors to get inflammation and pressure off of those joints. And that helps a lot. If you're someone that when you bend over, your back pain goes away, when you bend back, it gets worse, probably an apophyseal joint issue. So that's number 2. That's the second thing that I most commonly see with people coming in with back issues over the years. The final one, I just wrote these down so I'd have easy order. I'm sorry, the final one. The third one is disc issues. And that could be a disc bulge, all-out herniation. It could be, equestration, a completely broken off disc. There's all kinds of things that can happen with the disc. But ultimately, any disc issue, it could be disc degeneration if you lose the fluid. So let me just give you a quick lesson on the disc, okay? So when it comes to your spine, you have these discs in between the vertebrae. Inside those discs is a fluid. It's a jelly-like substance, and it's a liquid, right? And surrounding that disc is ligaments, okay? And those ligaments hold the fluid in, and it's like the cushion. It's the pad for your spine, okay? So when we jump up and down, we're okay because we have discs. If those weren't there, bones would just rub together. They'd fuse together to be a problem. It's kind of like having cartilage in your knee, okay? So you have this fluid-filled disc. It's a cushioning for your spine, and so gravity can handle and everything else. Over time, from not moving, the number one reason you're going to get disc issues is when you don't move. Just like any other joint in your body, if you don't move it, you lose it. So we have something called imbibition. So on a daily basis, we need to be able to move our discs to pump old fluid out and new fluid in. If you're someone that has a desk job and you're sitting 80, 90% of your day, you can pretty much rest assured you're eventually going to have a disc issue if you aren't moving all day long throughout that day, all different range of motions. We have our patients go through full range of motion exercises to pump all the discs in their spine, okay? So that's number one, you get disc degeneration. But yeah, so those discs are in there. Now what happens is from sitting too much, from car accidents, injuries, sports injuries, poor lifting, repetitive activities that you do with your spine and your back, sleeping wrong, things like that, you get these little bitty micro tears in these ligaments, and those ligaments get little bitty micro tears over the years. You lose the curve, right? Let's say you lose the curve in your back and it goes straight. Now all the weight of your upper back goes into your lower back. It puts too much pressure on one disc more than the other, which is why the lower back, lower 3 vertebrae and the lower 3 vertebrae in the neck are the most commonly herniated disc areas because of loss of curve in the spine, okay? So you lose the curve in your lower back or you lose the curve in your neck. Now that puts the weight of gravity into one disc instead of being evenly distributed. Over time, that builds up. You start getting little tears in the ligaments, and then one day you bend over, you pick up a pin and pop. We've all had that, or we've all heard of that, right? Or you just twisted the wrong way and pop. And that disc actually bulges or it herniates out. Now I've seen people with herniated or bulged discs, actually bulged discs, that don't have any pain. So there's a lot of people right now walking around, I forget the estimated percentage, but there's a lot of people walking around with bulging discs that don't even know it yet. And that's the one person that picks up a pin, they get that big herniation and they think it just happened that day. That's years of developing. That's why it's so important. Now, you can have an inflamed disc and that can cause pain, right? So that's the other place pain will come from, it's from a disc issue. And again, the first step of doing that is ideally being prevented before you have pain and making sure your spine's healthy by regularly getting it evaluated by a chiropractic doctor. Or if you have pain, getting x-rays. If the doctor suspects that it's a disc issue, which they're trained to be able to tell if it could be, and then they get an MRI, and that MRI will tell you if you have a major disc issue, okay? So number one issue is usually subluxation. Number two is apophyseal joint jamming when you extend your back. Number three is gonna be disc issues. The fourth one is actually a little bit different. It could be organic issues that are causing pain in your back. Some very common ones that we'll see coming in are kidney issues like kidney stones, okay? They'll cause pain in that middle lower part of your, upper lower part of your back, okay, like the mid back area. And that could be like a dull aching pain if you can punch the back and you kind of shocks you into your side. Very common with kidney stones. The other one is digestive issues. If you're constipated, it can push against your spine and cause pain. And then obviously just other things that build up pressure-wise, for pregnant women, many times just being so much pressure will cause back pain, okay? So it can also be an organic issue, less common. The upper back organ issues that we'll see, when you have upper back pain, especially in that right shoulder area, upper back area, and the rhomboid area, is gonna be the gallbladder, because the right behind the gallbladder is your phrenic nerve, okay? That's what controls your diaphragm, and that comes right through that area, and if the gallbladder is inflamed, it'll affect that nerve, cause pain, many times even stemming up into your neck. So it can also be an organic issue. So that's the fourth one. The final reason most people have back pain when they come into our clinic is a muscle tear or strain. And the thing is, that's actually the least common reason people come in. Okay, people come in all the time. I think it's just a muscle issue. The reason we think it's just a muscle issue if we have back pain is because your muscles are spasming. But your muscles are made to protect you and keep you moving, right? So when your spine is subluxated or it's degenerated or it's not moving properly or the joints are being jammed up, the muscles want to slow that down and stop the issue. So they'll inflame or get spasmed and lock up. So your back will actually lock up when you have a spine problem, and that's why we think it's a muscle issue. Rarely is it just a muscle issue. Muscle issues aren't really going to be chronic. Those are going to be acute. And what I mean by that is you had a car accident, you just tore your muscles, right? So we have patients that come in from a car accident, they literally just tore muscles, strained muscles, things like that. Or maybe an athlete was playing a sport and like a soccer player kicked the ball too hard and strained a muscle. Things like that are going to be your muscle strains. Those are more acute, and you can almost always link those back to something that you did or that happened to you, okay? So if you have a back problem and back pain, you can't specifically link it back, or it's been there chronically, probably not a muscle issue, okay? First thing that we usually see is subluxation. Second thing we usually see is apophyseal joint jamming or inflammation. Third thing we usually see is disc issues. Fourth is going to be organic, like kidney, gallbladder, or digestive problems causing back pain. The final one that we'll see, and actually really even liver issues will lead to disc issues, believe it or not, as well. And then the final thing we see is actual muscle issues in and of itself. Okay, so those are the top 5 reasons people come with back pain. If you're someone dealing with back pain, you're probably one of those. Most likely, if you're young and it hadn't had an injury with it, it's most likely you're subluxated. If you've had it chronically and you're older, a good possibility you have disc degeneration. But you need to know those things. Going to your doctor and just giving an injection to get rid of the pain, worst thing you can do, because you're increasing your chances of disc degeneration, which increases your chances of surgeries, and surgeries don't help. They actually really shouldn't be doing spinal fusions and all these other back surgeries. It is the reason we're on opioids like crazy, and opioids lead to heroin addiction. 90% of heroin addicts started with opioids. It's a huge ordeal. So change the way we're thinking. First thing, go natural. Go to your local chiropractor. Find a good doc that you connect with, that you know that knows their stuff, right? They're active in the community. They're getting out. They're doing videos. They're doing stuff. They're teaching. That's a good sign. That's a sign of a good chiropractor, in my opinion, because they're out to teach. The definition of a doctor is a teacher. We want you to become empowered to be your health expert, right? And I think a good chiropractor is doing that. So find someone that is teaching, is really want to educate you on what's going on in your body. They want to show you x-rays and see what's happening in your spine. I don't like to work blindly. I want to see what the spine is doing. And ultimately someone that's going to create a care plan that's going to work for you, right? That you're going to be able to follow, and then teaches you how to do stuff at home to make sure that the actual adjustments and everything else they're doing with your spine lasts, so that it's not just a quick fix that gets rid of pain and then the pain keeps coming back. That's the key. In our clinic, we do something called spinal correction, which is we look at x-rays, we look at all the other testing and stuff we do, and then we evaluate from that stance on a best plan possible for you, and we create an action plan so you can get correction, which means not only are you out of pain, but we can see a change on x-rays as well. You have better range of motion, and then that makes a longer term result where you can keep doing your stuff at home. Cool? So those are the 5 things. Think about that. If you're someone dealing with back pain, make the choice today to actually do something about it. Go to queencityhealthcenter.com, schedule an appointment time in Matthews or in South Park. We'll make that work for you. We actually do a free consultation with you, so there's no loss. And if we need to do any x-rays, we'll walk you through what x-rays cost and everything else, and then we'll show you what you need to do to correct it. Okay, so queencityhealthcenter.com. If you don't live in Charlotte, feel free, message me, send me a message on Facebook, and I'm happy to find you someone in your area. I have a network of doctors all over the country, and there's plenty of good people out there. So you got to find somebody to go to. But I'll tell you this, that getting under chiropractic care will be the best decision of your life if you do it. Okay? Hey, you guys have an awesome day. Again, I'm Dr. Kyle Loveless. Thanks for watching this Top 5 to Health series here that I'm doing. And yeah, continue to watch, share this. Hey, if you got a lot out of this, other people will too. So share it with them, and also like it and love it, and give me any comments or feedback if you have any questions or anything I can help you with. You guys have an awesome day.